Good afternoon, everybody, and welcome to the Stigma Rebellion and Dr. Tess Crawley and Associates Facebook page. I'm a little bit behind time today, so bear with me. I am getting my little doovers in that will hopefully get the sound a bit clearer as we go along. I also need to get us streaming into the Stigma Rebellion, so bear with me while I do that as well. So I hope you're all having a lovely Sunday, whatever you're doing. I've had one of those days. I have to tell you, I was going to make myself a coffee, like a nice coffee, to have while I was talking to you, because I've been looking forward to a coffee all day. And I confess, this is the first time I've sat down all day. It's just been one of those days where I have been saying, I'll just do this and then I'll do that. And before I've known it, the day has gone away from me. Okay, so sharing onto the Stigma Rebellion. Let's see how we go. There we go. And that should be done. So it's gone off to tell me to talk to you guys. Right, okay, it's all going on today. So if you are new to these videos, my name is Tess Crawley. I'm a clinical and forensic psychologist, and my practice, Dr. Tess Crawley and Associates, is based in Hobart. We also have an office in Launceston, and we do rural outreach around Tasmania. We also offer services online, so if you're not in Tasmania but you're keen to speak to one of my clinicians, you can certainly feel free to contact us and we'll talk to you about what we can do. The easiest way to contact our team is via our website, so tesscrawley.com.au, and there's a contact us form on there, and we'll get back to you. Otherwise, you're free to call us, of course, on 03 6223 2122. That's our Hobart number. I always give out the Hobart number, even though there is a number for Launceston as well, but all of our new referrals are handled centrally from Hobart before being allocated to clinicians in the different regions. Alright, so today, this is my third video on borderline personality disorder. Now, I've deliberately sort of stretched these videos to bridge borderline PD Awareness Week and mental health awareness weeks around the country. So I've been a bit sneaky and covering both bases with these videos. So today we're talking about how do we treat borderline personality disorder, because historically there are a lot of assumptions that BPD could not be treated. So one of the things around psychological treatments that some people don't know is that psychologists don't prescribe. In Australia, psychologists are not allowed to prescribe medications. In some other countries they are, but in Australia we're not. And so all of our therapies that we use are talking-based therapies, and the most well-known therapy in recent times that psychologists are known for using is cognitive behavioural therapy, and that uses a combination of cognitive strategies, so strategies to help with your thinking, and behavioural strategies, so strategies that get you doing something to help the way you're feeling, so combining cognitive and behavioural elements to our therapy. Now, in recent decades, I would say probably from about the 1980s onwards, there was a movement to increase the understanding of borderline personality disorder, and there were two key writers in the field that really have influenced my thinking about borderline personality disorder and its treatment. The first of those is a woman named Judith Herman, and she did a lot of writing around the notion of complex PTSD. So she talked about, or she criticised the old diagnostic criteria for post-traumatic stress disorder, which is PTSD, that relied on there being one single event, and that event was of significant seriousness as to either cause the death of, so the person suffering PTSD either witnessed the death or the near death of somebody around them, or they were almost killed themselves. So it had to be a near fatal incident and a single one-off event before, and that was one of the major criteria for diagnosing post-traumatic stress disorder. And Judith Herman said, well, hang on a minute, what about all those people who suffer multiple traumas that they can't get away from. So thinking about, you know, children in abusive environments, women in violent relationships, sex workers, emergency services personnel, so people, veterans. So thinking about individuals who've been exposed repeatedly to, either due to the course of their living circumstances or their working circumstances, to multiple sources of trauma that were not necessarily potentially lethal. And Judith Herman quite rightly noted that those people met all the other criteria for post-trauma reaction, but it was a more pervasive response. And so she was sort of leaning into borderline personality disorder understanding with the work that she was doing, but she was looking much more from post-traumatic stress side of the fence, because many people with borderline personality disorder, not all, but many, have had a trauma background. In particular, many of them have had a sustained trauma exposure, so where they've been repeatedly exposed to trauma, particularly in childhood we're talking about. So Judith Herman sort of introduced this notion of complex PTSD, and then over the years some people, some clinicians and some researchers started using the term complex PTSD as interchangeable with borderline personality disorder in an attempt to get away from the stigma associated with the label of BPD. But I think so much work has been done more recently to raise awareness of borderline personality disorder, that the stigma is, we're finding a healthy balance emerging. We're not there yet, but emerging, between overcoming that stigma and people embracing the diagnosis as something that's helpful. So like I said to you yesterday, I had a client who felt that she might have borderline personality disorder and she wanted to know for certain. To her, having that diagnosis clarified in her own mind what it was she was dealing with, and that we would then get on with dealing with the symptoms of that condition and treating it appropriately. So the second writer was another woman from America called Marsha Linehan, and Marsha Linehan is very well known in psychological services, psychological circles, for people who are treating borderline personality disorder, because Marsha Linehan came up with Dialectical Behaviour Therapy, or DBT, which is the gold standard therapy really for treatment of borderline personality disorder. And what Marsha Linehan did was she devised a therapy based on skills. So she sort of did away with the cognitive behavioural therapy approach, but she had that as her foundation, but she built on it, and she said, okay, it's all well and good to be in our minds worrying about our thoughts, but we also need to be looking at the skills that we're missing out on in these individuals. So she did a lot of work around developing identity through. I thought I'd put my phone on Do Not Disturb, but clearly I had not. Now I've lost my train of thought, sorry. So Marsha Linehan doing lots of work around identifying the skills, or looking at the skills that are lacking. So I've talked a little bit about this over the last couple of videos, the skills that are lacking in emotion regulation, so being able to regulate your emotions and manage them. Distress tolerance is a big issue with individuals with borderline personality disorder. Being able to tolerate any unpleasant emotion is almost impossible for these individuals. And then interpersonal relationships, self-concept. There's a range of areas where Marsha Linehan devised some really clear and simple and easy to follow and understand strategies for how to build skills in each of those areas. So she developed Dialectical Behaviour Therapy as a module-based therapy, so a set series of modules that the individual would go through with their therapist. Typically, Marsha Linehan would do it often in a combination of group therapy and individual therapy. Marsha Linehan is very prescriptive in it. Thou shalt only do it by the book. And of course, in private practice, it's not always feasible or realistic to offer group programs. Sometimes we've been able to, sometimes we haven't been able to. And so there's been a growing movement again since some great work expanding upon that therapeutic knowledge and applying it to individual therapy in private practice. And so that's what we do a lot of now. So we look at distress tolerance is usually the first port of call for us. So we will look at some skills around how to identify and tolerate difficult emotions. So we do that using some physiological strategies, so some breathing techniques to help calm the body. Now, if you've seen my anxiety videos, I see Cleo and Frank are with me this afternoon. Good afternoon to you both. If you've seen my videos in the past on anxiety, you'll see that there's a section there or video there on how to use breath to control or to manage the physiological symptoms of anxiety. It's the same strategy for the same reason. So we're talking about people who are getting distressed because of unpleasant emotions, because of course they've grown up in an environment where it's not safe to expose their feelings. So they're desperately trying to squash them down, and that becomes an internal battle and quite distressing sometimes. So we use breath as a bit of an anchor, and then we'll build on that with some additional distress tolerance strategies. Then we might look at some skills around emotion regulation, so some strategies for learning how your moods shift and change over time, learning to recognize your different moods and emotions, teaching people that different emotions, positive and negative, are all part of the normal human experience, teaching people how to label their emotions, because if you've spent your whole life squashing your feelings down, you're not going to be very good at recognizing what they are when they occur. So boredom and anxiety, for example, can look really similar. Stress and anxiety, fear and excitement are physiologically very similar. So being able to learn how to tell the difference between what's going on, in recognizing what's going on in your body, recognizing what's going on in your mind and what that is, what that means, and recognizing also that emotions occur on a wave, that they will come and they will pass. So learning how to recognize those emotions and learning how to tolerate them as they pass over time. So they're some of the key strategies that we would use, and then we'll teach some interpersonal skills. We'll teach some skills around self-worth and self-value, self-validation, self-compassion, things like that. So today I'm going to give you one little sneaky strategy that I find myself accidentally using sometimes, and it's called a half smile. And this is one of Marsha Linehan's little tricks. Marsha Linehan's therapies all smattered with lovely little snippets of things that you can take away and use for yourself, and some of them are quite entertaining. The half smile is about a bit like when we're using breathing to trick our anxious mind into believing that the danger has passed. We're using the breath as a messenger to get to that part of the brain that controls the fight or flight reaction. We can use the muscles of the face to change our mood, and so the half smile is a bit like a Mona Lisa smile. You know, you're not smiling, you're not grinning, you're not grimacing. You're lifting these muscles at the corner of your mouth as if you're about to smile. And the trick in how to do that is teaching yourself when you're practicing it to think of something that always makes you smile. And when you're thinking of something that always makes you smile, you're not going to launch into a great big Joker grin, are you? It's just going to lift the corners of your mouth. So I always struggle to do it when I'm showing people, but I'll try my best. Get my poker face on. So if you imagine that you're in a really bad mood, and then you imagine that you're thinking of something that always makes you smile. Do you see that? A little bit, just a tiny little bit. That engages these muscles here, which again sends a message up to the brain, and that can work. So if you're caught in some crabby mood, think about that. You're driving to work, you've had a rough morning, and you're in a really crabby mood. That little half smile. So it's just a half smile. It gets you thinking. You've got to think about something that makes you smile, and let that thought lift your muscles in your mouth, and you'll find that your mood will lift with it. I want you to practice that. See how you go. It's one of my favourites, and I often forget to talk to people about it outside of the therapy room, but it is such a simple little strategy and something that you might try. Now, that is not the be-all and end-all of therapy for borderline personality disorder. Often we are working with clients for a very long time. Borderline personality disorder is very hard to treat successfully in private practice in some cases. So, for example, in private practice, the first, if you're eligible, you can have access to your first 10 sessions having a rebate from Medicare, and beyond those first 10 sessions you might be able to access a rebate from your private health fund, or you might be paying the full fee for yourself without a rebate, and that's fine if you're working. Problem with a lot of people with borderline personality disorder struggle to maintain work, and so that might be difficult for them to afford that process in private setting. So we, over the years, have tried to incorporate additional supports in our practice to stretch out those Medicare rebatable sessions. So if we've got a client with borderline personality disorder, the lead clinician would work with that client to stabilise them, and then they might involve one of our interns as a little block of free sessions to sort of work on some particular strategies to cement those. Hi Kim, I can see you've joined me too. And also I'll just check and see if I've got any questions in the Stigma Rebellion while I'm here, sorry. So we will stretch out those sessions so that there's some free ones there, and then that's all good. And do what we can to make therapy affordable, but unfortunately sometimes, especially with borderline clients who are at the very, very early stages of therapy, where they've never had any therapy before and they're in total chaos and their life's in real crisis, it might not be that private practice is the right place at that particular time for them. So what we will do is we will look at what other services are around and support them to transition off to another service. So the government services in particular, adult community mental health services, they do often have a very long wait list, but they are a free service, and they're not a time limited service. So once you're able to work your way through the wait list and get onto their books, then you've got all the time in the world. In fact, that's where I used to work a long time ago at Gavitt House in Glenorchy, working with almost exclusively borderline personality disordered clients. So, we certainly do see some borderline clients in our private practice. We see quite a few of them. But sometimes we have to make the tough call and encourage those clients to be supported while we encourage them to go and see another service, if that's the best service for them. Because we're always mindful, what stage is the client at in their treatment? Are we the best service for that particular client at this particular time? And sometimes we're not, and we have to be really honest with our clients and say, as much as we would love to help you, our service is not the service for you at this particular time, but we'll support you while we help you find, or while your GP finds the appropriate service for you. And that can be, disappointing for some clients who want to get in and get started, but if they can't afford private therapy, or if they've already exhausted their 10 Medicare rebated sessions somewhere else, they might find that it's not an affordable prospect for them. But we do what we can. So we try our best to support those clients who are coming to us. All right, so I will talk again tomorrow about self-harm. So a bit of a warning. I keep calling these sessions. They're not sessions, are they? They're videos. Tomorrow's vlog will be about the link between self-harm and borderline personality disorder, and that is a topic that I've saved and put a discussion as a separate standalone vlog, because I'm aware that self-harm is a topic that some people might find a bit triggering, and so I will talk about that tomorrow, being Monday. If you're finding these videos helpful or interesting, please let me know. If you've got any questions, please let me know. If you've got questions and you don't want your friends and family to know that you're asking me questions, you can jump on into the Stigma Rebellion, and that is our what's called a closed Facebook group. It just means that it's a bit more private. So once you're a member of that group, no one else outside the group sees your comments. So if you've got some questions about borderline personality disorder that you think I might be able to help you with, and you're a bit shy about others seeing those questions, jump on into the Stigma Rebellion. You can search it on Facebook, and the group will come up. You then request to join, and everybody's eligible to join, but because it's what's called a closed group, you've got to ask before you can join in. And of course I will welcome you in with open arms. The Stigma Rebellion is a growing little group, and I'm finding it's really quite lovely to have these two communities, the broad open group and the closed group as well. So feel free to jump on in there and ask some questions. If you know somebody who is struggling with borderline personality disorder, by all means, direct them to these videos if you think they might help. Now, if you're searching for the videos I've referred to in the past, like the anxiety videos or earlier borderline videos, there's two easy ways, rather than trying to scroll through the Facebook feed, there's two really simple ways to find previous videos. One, you can just go to my Facebook page and click on videos, and they'll all be there in order. Alternatively, you can jump onto YouTube, and I have a YouTube channel there, Tess Crawley. So, and again, they're usually mostly up. I've just updated them. Of course, I've just been away, so I got a little bit behind with YouTube, but we're up to date at the moment, and I try my best to keep YouTube at least within a day or two of being up to date. That's it from me today. Have a fabulous Sunday afternoon, and I'll talk to you all again tomorrow. See you then. Bye-bye for now.